Dr. Bill Adams here, and this is No Spin Live, and we have a great show for you today. We're going to talk about a Florida surgeon ban from cosmetic procedures, and also a little bit about mainstream media in the breast implant world. Are they reporting the truth? We've got three international experts in plastic surgery to share insights with you. We've got Dr. Rios from Edinburgh, Texas. We've got Dr. Jason Pozner from Boca Raton, Florida. And last but not least, also from Florida, Dr. Charlie Messa from Weston, Florida. Jason, I'm going to start with you because you actually sent me this initially. This was about the Florida Medical Board had accused a Miami surgeon, I guess on last Friday, of misleading patients. And there's been some question of what his training is. And ultimately, I think that he had some patient deaths and now has been banned from doing cosmetic procedures. So lead us into this one.
You know, I think we've approached this a number of times on No Spin, which is, basically patients need to be aware of who you're going to. And this was a situation of a non-plastic surgeon doing plastic surgery in a clinic. And these clinics typically in Miami have problems and they change the name and go out of business, on a weekly basis sometimes. So I think it's just an awareness problem. This is a guy with no formal plastic surgery training, got into some trouble, and, was led to go on for quite a while having these problems before the board stepped in. So again, patients be aware that if you're looking for cosmetic procedures, really, if you want breast surgery, facial surgery, liposuction, I wouldn't send anyone but a board certified plastic surgeon for this.
Yeah, Charlie, when I was just in Washington at the FDA committee meeting for breast implants, and this actually came up quite a bit about should medical devices in breast, because they were talking about breast implants and acellular dermal products and that sort of thing. Should they be restricted to board certified plastic surgeons just because of, at least you have control over the training? And there was actually a lot of good arguments, to support that. But Louis, it can be hard for patients to tell who's properly trained, correct?
That's correct. And, it all comes down to, and, what surprised me here again with the Florida Medical Board, and we see it with other medical boards time and time again, this guy killed people, the latest one in December of 2017. And here we are, like 16 months later, talking about this, and now they're going to impose. What took 16 months to get a guy like this? What's going on with the medical boards that they're allowing this to happen? And why wasn't the police involved? Someone died, he basically killed someone. He doesn't have the training to do this. He shouldn't be doing this. He's doing it in a place that he shouldn't be doing it.
But Louis, can I argue with you a little bit? I think there's a little bit of a gray area with a lot of things because, think of this from a global perspective. You're the medical board. So let's say, one of your kids has a lung infection and you give them antibiotics. Is that beyond the scope of your training, or a urinary tract infection? I think, it's very hard to look at certain things. Certain things it's obvious. We want to put breast implants for cosmetic use. Sure, it should be a board certified plastic surgeon, but we do have licenses that are a little bit broader in scope where I might prescribe some antibiotics or something else for somebody else and, might consider that be a little bit of a gray area.
Yeah, but don't you think, prescribing antibiotics, that's like so... We're all doctors. There's no specialty like antibiotic prescription, specialist in antibiotic prescription. I think Louis' point is really a great one because it talks about two things. Number one is that, like this guy he killed people, and it always takes these extreme things for anybody to do anything about it, which is absurd because we all know that that's just scratching the surface. It's really unfortunate somebody died or other patients died, but there was probably hundreds that were harmed and had terrible results because it does. I think the surgical training at least minimizes some of those things.
You shouldn't be office-based surgery unless you have hospital privileges, documented hospital privileges to do those procedures. Because to get hospital privileges, 99% of the time you have to be board certified and show evidence of residency training, number one. Number two, don't you be able to advertise in Florida unless it's a board that's documented by the American Board of Medical Specialties. So in that scenario, you won't have someone saying I'm board certified without specifically stating the board, and the board has to be an ABMS board. So if you do those two things, you're going to eliminate 99% of the problems in Florida. The other thing you can do is make every facility to be either JACO certified, Quad A Quad SF certified or AAA8C, because all those their certifying boards require board certification and ownership by a physician. So that wipes out 99, not 100% of all these chop shop centers that show up all over the place in South Florida.
Yeah, that's some good stuff, guys. I know we'll talk about this more, but hopefully these boards will get some of these messages, because I think it's very clear, very straightforward. There's a solution there that's easy. All right, let's go on to the next subject. This is talking about really a couple of things, just coming off the breast medical device committee meeting up in Washington, D.C. a couple weeks ago. It was talking about many different things regarding breast medical devices, breast implants being probably the frequent topic. But there was talk of informed consent, I think, which again it was a big topic of conversation. And then I think we also want to get into some of the media that's covered some of this, because there's a lot of skew and a lot of the media coverage. And really, I think a lot of times the patients and the public's not getting the true story. So Louis, why don't you lead us off on the informed consent?
Yeah, so I think, that's going to be a big issue here. And, one of the problems that we're having with, like, for example, breast implant illness is, we want to have the science, and it's going to take a little bit of time to get there so we can understand, is this a diagnosis? What test do we need to run? But I think one of the big complaints, the women who think they have breast implant illness, is that they're not getting proper consent. And so even if we can't prove the science and say that's a real illness, well, they can come in the back door and say, well, you know what, we weren't given proper consent anyway. And so, I think it's a legitimate point, and I think that we need to shore that up a little bit. And we can talk about the media coverage in a little bit, but that's kind of what I think. I think that we could maybe, as a society, maybe do a little bit better. I think we still do a pretty good job, but I think to this specific point, it's going to take a little while for the science to get there. So let's shore up what we can shore up. And I think we'll all be better off, patients and doctors.
We've talked about this, how many breast implants have been placed in the world, the existing patients now? 10 million breast implants probably right now.
70 million, probably 50 to 70 million.
At one time now? Or
total number that's out there.
And then if you look at the numbers, the complications are pretty low, but as numbers start to come out, there may be a small percentage of people who have some issues with some aspect of it. And it's just a matter of study. It's not like it's talking about vaginal mesh on TV, where a lot of the percentages are having problems and then they pull it from the market. We're talking about a small percentage, and really only over time with large studies can we figure out which cohorts of people may be affected in the population. So I think it's just a matter of time. The consent obviously need to reflect this, and I think just over time I think our societies are all taking this very seriously. We're doing a decent job looking at and studying it further and trying to figure it out. It's not like a surprise. People are talking to us about ALCL and BII, and we're like, well, we've been working on this for years now. It didn't come out last week because there was a media report on it. Our societies have a lot of money and time spent on figuring this stuff out. Give us some time.
I definitely agree that as we gain more scientific evidence, we should adjust and modify our consents. But when you're talking about breast implant illness, it's very replete with information that states that once these implants are removed, that most of the time, the immunologic complaints don't improve. So and it's been well studied and well documented. There's not directly a causal effect to silicone implants and autoimmune disease. So I think patients are very different. The constellation of symptoms that characterizes breast implant illness can be linked to numerous different inflammatory and autoimmune pathways. So I don't know that you can just specifically say, okay, you put an implant, you can get breast implant illness, because every patient is different depending on their immunologic makeup. We will have to deal with ALCL, but I've treated a lot of patients who get their implants out, and I've done presented a prospective study I did last year at ASAPS, where their autoimmune complaints really didn't change, but the subjective to complaints, from breast pain to discomfort, those kind of things all got better.
All right, well, let's wrap up on the media. There's been a lot of media coverage of this. It always seems that the media certainly takes one side of the story with not too much levity. I saw one article which I thought was excellent from New Beauty, which was very well balanced, I thought. But it's rare to see something like that. It's usually very skewed and biased. But what do you think, Louis?
So yeah, you sent us an article from the Wall Street Journal. It was just interesting. Words do matter. We've learned that with the current president, right? But in the article, they mentioned how 20% of women have their implants replaced because of these horrible complications. And really, we know that the majority of them aren't because of complications. It's because they want to go bigger or smaller. It's kind of an elective thing. It's not because there's a problem. And I think, too, the point is if you look at Real Self, breast implants have a 98% favorable rating with 30,000 people, over 30,000 people doing reviews. So here you have a product that 98% of people love it, but if we go back to the 1990s and shut it all down and we don't have the science, then we're hurting 98% of people who are benefiting from it and liking the implants.
Well, I think that, number one, the ASPS statistics, there's a 48% increase in the number of breast augmentations done in the last 18 years, with it being number one cosmetic procedure performed. So now we have more and more women who have breast implants. So relatively speaking, it's a very small number. More and more women are potentially going to have complications or problems, and there's more awareness, there's more acceptance to be open about cosmetic surgery and cosmetic procedure, especially with social media. So I think it's just something that's now more in front of our faces in terms of it's out there, people are talking about it and more open to talk about it. But in general, the volume of breast implant procedures being over 300,000 yearly, the number of complications and complaints is very, very low. I think the media just likes to hype the negative as opposed to really giving you all the factual data that's out there.
Jason, you get the final word.
You know what? How do you sell TV space and how do you sell newspapers, right? For TV space, you put a bunch of women at an expensive restaurant and you have them yell at each other and throw things. That gets ratings. So the same thing with media and plastic surgery. Do you think talking about how happy women are with big boobs and big butts and skinny waists? No, that doesn't sell him. That doesn't sell anything. You want to talk about all the negatives and the problems and the people screaming at each other. So I really think things are just overblown. Most people are very happy. The complication rates of things are low. We need to tidy up a little bit, but we're working on all that stuff. And most plastic surgeons that I know, pretty much everyone I know and associate with, are hardworking men and women who take their job seriously and care for the patients and try to do the best. So I wish the media would kind of take a real look into our lives and not this overblown horseshit.
All right, that's some great stuff, guys. Thanks so much. And if you want to see more of this, you can see it on the plasticsurgerychannel.com.